Hey everyone, welcome back to my channel. My name is Kelly and I am a physical therapist and I specialize in lymphedema, oncology, and women's health. When someone has swelling or lymphedema in the leg, the foot, or the ankle, or just the whole lower body in general, the main treatment option is compression. But what kind of compression? For most individuals, a doctor or therapist will tell someone to wear a compression stocking or a compression garment. But that can get really overwhelming because there are so many different types of brands, styles, shapes, and sizes, which can get overwhelming not only for the individual or patient themselves who are looking for the compression stocking, but also for lymphedema therapists and doctors. The types and styles of compression stockings and garments are constantly changing. And although that is a really positive thing because they're always trying to better themselves, finding what works best for each individual, it can just feel like a little bit too much to figure out sometimes. So I'm creating this series on my channel to go through the different types of compression stockings and garments and brands out there right now on the market as of 2021. So if that is something that you're interested in, be sure to subscribe down below and hit the notification bell so you can see when those videos all come out. But in this video today, I'm going to go through and break down the best compression stocking options for swelling and lymphedema of the leg and the foot. So before I begin, I think it's extremely important to note that everyone is different. Everyone is going to be a different shape and a different size and a different silhouette, as well as going to have a different cause to their swelling or different types of swelling, as well as their own personal medical needs. Therefore, the best decision of the type of compression stocking that you will wear is between you and your provider, such as your lymphedema therapist, your vendor, or your doctor. I'm just here to bring the knowledge and show the different types and brands of compression stockings out there right now to hopefully help start a discussion between you and your healthcare provider. So when would we use compression stockings or garments? Like I said before, compression is the main treatment option for swelling anywhere in the body. Compression is going to assist in moving the fluid out of the area because when you put compression on an area, it does change the amount of pressure inside, and that's going to force the fluid to move up and out of that area. Swelling that sits in one place for a long time, especially something like the legs and the lower feet, can change someone's tissue or skin over time. They may feel that it hardens over time or can even cause wounds or openings in the skin, and that can lead to infection. So because of that, it is something that is important to get addressed. The other treatment options that your lymphedema therapist may do is something like manual lymphatic drainage, which is a lymphatic massage technique to help get the fluid moving up and out of the area, which I have created other videos on to show what manual lymphatic drainage for the lower extremities looks like, and I will place some links for that down below. The other piece of the puzzle is exercise. Your muscles act as a pump, and so when they're squeezing in the lower legs and the feet, that can help stimulate to pump the fluid up and out of the legs. So let's get into the compression stockings and garments now. I'm going to break this up into 3 different sections, starting with light compression to moderate compression to more advanced compression. Overall, in general, with all compression stockings and garments, they stretch out or have a life of about 4 to 6 months before needing to be replaced to have more effective compression. When someone comes into me in the clinic and they say, I've tried compression stockings, they're not working for me, what do I do? The first thing I'm going to ask is, how old are they? Because if they're over 4 to 6 months out, and some people will come in and say they're years old, well, I know that they're probably not working because they're too old. But the other thing I'm looking at, is it the right amount of compression for them? And so some people will start at these lower level of compression and will gradually work them up to more intense. But if someone has true lymphedema, then we know we need to start at the higher levels first, because that's going to be what's going to give the best containment and give the best overall support. Other factors that play a role is someone's silhouette and someone's shape and the type and texture of their skin and tissue. But if someone doesn't have access to a therapist, then this is hopefully helpful to help you and your doctor pick which type of garment to try. And if you're looking more for a financial reason, unfortunately insurance doesn't always cover these compression stockings and garments, and they can get really expensive. But the links down below are some of the cheapest options that you can find online while still finding the best brands and quality products. So the first group of compression stockings are the light compression. These are for someone who have really mild swelling that maybe swell throughout the day or by the end of the day, but maybe in the morning they're small again because their legs were elevated all night. These are going to all be off the shelf, which means they're already pre-made, come in certain sizes, and they are what we call circular knit garments that are woven in a way that's just symmetrical all the way around. Compression stockings and garments come at a knee-high level as well as a thigh-high level, and you can also find some that come in a full pant. This level of stocking may be prescribed for someone who has just mild vein issues or notice that little bit of swelling, even like something like pregnancy or after a surgery. So first will be the Juzo 2000 series. It comes in a knee-high and a thigh-high version. A medical level grade compression, just kind of the basic medical grade, is a 20 to 30 millimeters of mercury. That's the amount of compression that it gives. How that relates to the Juzo is that there's a 2000, 2001, and 2002. 2000 is a 15 to 20, so it's a really, really light compression, not necessarily all the way to medical grade, but great for some people who can't tolerate more. A 2001 is the standard 20 to 30 medical grade compression, which is what I have in my hand. And then there's a 2002, which is a 30 to 40 in a higher grade. But going back, so this is a 2001, 20 to 30 is the level of compression, just a standard amount. The Juzo Soft is a great basic stocking. It is really soft and comfortable. This is great for those who have some of that vein issue or that light swelling. I actually recommended this to one of my family members because it does give that little bit of compression for someone who had a little swelling, but you can get it with and without that silicone band at the top for comfort. It does have a lot of give to it while giving some sort of gradient compression, which you'll see with all of these. There's a little bit more compression at the ankle and it gets to be a little less as you get to the top because we want the fluid moving up and out of the leg, so it squeezes a little bit extra at the bottom, working its way up. But you can get this with open-toed or closed-toed, and it has just a uniform amount of compression throughout. When looking at the sizing for Juzo, they come in sizes 1 through 5, and they have different lengths. So they have a regular, a short, and petite. And so there are 3 different options for length, depending on the length of your lower leg. What I see is most popular about Juzo is that they come in a really wide range of colors. And so I have my samples here. They have probably the most neutral colors out there of all of them. So they have multiple different nudes and beiges and tans, as well as your basic black, navy, and white. And they also have a lot of really fun, bright colors, which they call more of their trend colors that someone can choose from if they're looking for something a little more fun. Here is the Juzo Soft in a thigh high, so it looks short, but they do have a lot of stretch to it. So again, it's just something for that basic everyday wear light compression. The other thing Juzo has, which is not necessarily their soft series, but they also have men's compression as well. What I just showed with the soft can be both men and women, but men also have a couple options that are look more like a professional work sock or athletic sock. The next one's going to be a Medi Comfort. So I don't have a lower leg, but I do have the arm version for the Medi Comfort just to show the fabric. This is a nice bright one they sent me. But like the Juzo Soft, it's a really soft fabric. It has a lot of give to it. It will give that gradient from the foot all the way up to the lower leg, and it's just going to be a nice thin everyday sock as well. They will have that silicone band or without silicone band at the top so it doesn't roll down, and this is just another great everyday wear option for someone who has that mild swelling. The Mediven lower leg has 7 different sizes, 1 through 7. They also have different lengths as well. They have about 6 different colors out there that someone can choose from with more natural or nude or basic colors. The band at the top of the Medi Comfort is wide. It's 1 1/4 inches in width, so it's going to give a little bit more comfort. This is the R one, but if something were to be a little bit thinner, it can cause more of a tourniquet on the lower leg, so having that wider band's a nice option. And the last one that I don't have a sample of is JOBST Relief. JOBST is a really well-known and trusted brand that has really good quality products, and JOBST Relief is their basic compression stocking that is extremely popular. The stocking comes in a knee-high level, a thigh-high level, and has open and closed-toed, as well as comes in a 20 to 30, which is that standard medical level grade compression, or 30 to 40, which is a higher level compression. It's a great option for someone who has that mild swelling, vein issues, or after surgery, or even pregnancy. You can get it with and without that silicone band at the top to keep it up, and like the other two, it does have a lot of good flexible movement with it, and so that it will move with you as you are active. The JOBST Relief also has a large range of colors, about 10 to 12 of them, and the sizing runs in a small to extra large sizing with options for a wide calf. It also comes in 2 lengths, either a regular or a petite. I would say of these 3 options, the Juzo 2000 series or the JOBST Relief are probably the most popular, but the Mediven Comfort's a really great option with those as well. The Juzo Dynamic is going to be another soft fabric like the Juzo Soft is. You may see it also as the 3000 or 3500 series, I think. That's a little bit more containment and a little bit thicker of a fabric compared to the Soft, but it's still going to be comfortable overall. The Juzo Dynamic comes in 5 different sizes as far as the widths, and it comes in 20 to 30, 30 to 40, and 40 to 50 millimeters of mercury. The fun thing about Juzo, like I've talked about in the other ones, the Juzo has a lot of really fun colors. They even have tie-dye options that you can choose from. The Juzo Dynamic is a really good option that is off the shelf, but you can also get it customized if you choose to. It has good containment while still having that softness and that compression like a circular compression garment will. You can get it open and closed toed. You can get it knee high, thigh high, and with or without the silicone band. It's great for someone who has mild to moderate swelling, varicose veins, or those who have chronic venous insufficiency. The next garment I'm going to talk about is the Mediven Forte. I don't have a specific sample of the Forte, but it is similar to the Juzo Dynamic in the amount of thickness that it has as well as the containment. I do have a Mediven Harmony, which is arm sleeve, but in that middle grade compression. So it is a thicker type of fabric than that really soft like the Comfort is. However, it is still a circular knit garment, so it's not going to be as strong as a flat knit, but it will give that higher level of containment than the Mediven Comfort will. Like the others, it will come in open and closed toed, knee high, and thigh high, as well as a range of colors. The Mediven comes in 7 different sizes to choose from, so a very wide range of sizes, as well as it has regular sizes and an extra wide calf option. For the lengths, they come in standard and petite options as well. The Mediven Forte is a very strong compression and very durable fabric. It's used to treat advanced venous disease or more moderate levels of swelling. Similar to the Juzo Dynamic, which I didn't comment about, but they do have a little bit of silver in them. Silver is meant to help reduce any bacteria buildup and for some to help decrease the odor. The next garment is going to be the Sigvaris Secure. Others, it's going to have a little bit of a thicker compression or a thicker amount of fabric for higher containment. It will, like the others, have a silicone band. The thing about this brand is that it does have a little bit wider band, I feel like, compared to the others, which gives more of a spread out, less of a tourniquet feel, definitely less likely to roll down. So some like that, some don't, but if someone wants a thicker band, this is a great brand to go with. I also find that the Secure has more of a gradient that is what I say palpable compared to the other brands. So Sigvaris has a compression gradient, they all do, which means it has more compression at the foot and ankle and less as you get higher up. But when you feel the fabric, you can really feel the difference. That can be a little bit more rough or too thick for some people, but for those who really need that extra gradient pressure, this is another great option. And they also have options for 20 to 30 and 30 to 40. The Secure has a wide range of sizes, which I think end up being about 16 to 20 different options for sizing, but they tend to stick more to the basic colors than the other brands do. The last garment for this moderate section is L&R USA's Solaris Exo Soft. I don't have a sample of a lower extremity Exo Soft, but I do have a sample of the glove for the fabric. So as you can see, the fabric is pretty durable. It is pretty strong overall. It's going to give that moderate level of compression while it's still a circular knit garment. I would say overall this is a softer fabric compared to the other ones that are in the moderate section, not as rough, but it still has that durable feel, which is really nice. They do have a 15 to 20 level of compression for the lower leg or knee-high garments, but 20 to 30 is what they have. That is the standard. You can get with the silicone band and again, open or closed toed. Their sizing runs from small, medium, large, I think all the way to extra large, and they have 2 or 3 different lengths, a small or short, regular, and a long. So the last section we're going to talk about is that highest containment or that highest compression section. These are mostly, or really all of them, are flat knit garments. The circular knit ones are the one we just spoke about. They are a lower level of containment. The flat knits are typically found to be more customized, and they are for those who have that moderate to severe lymphedema or swelling. If someone has tried a circular knit garment and they don't feel like it holds their swelling very well, then this is the type of garment someone should be in. They are a thicker garment overall, but that is going to do the best job of containing. For someone who uses the circular knit in the first 2 sections we talked about and get tourniquets or either around the ankle or around below the knee, those are going to cause a lot of pain and maybe skin breakdown. The flat knit garments are customized and meant to lay a little bit more flat around your body, and they are a lot less likely to tourniquet. So that's the other time that someone should shift from a circular knit garment to a flat knit garment, and so they don't have any tourniqueting and it fits their silhouette or their shape. So the first one's going to be the Medi 550. I don't have a full sample of it, I just have small samples. The Medi 550 has fabric that is that flat knit garment or that flat knit fabric. It is going to be really durable, really thick overall, and it's going to be something that you can get customized. When we're looking at the flat knit garments, they no longer go into just 20 to 30, 30 to 40, 40 to 50 in the way the compression sits. They're actually more categorized as class 1, class 2, class 3, class 4. I know that gets really confusing, so work with your therapist or your vendor to help figure out for you where you're at. A class 1 in a flat knit garment is about the same as a 20 to 30 in a circular knit. So again, that's a different type of fabric, so it's completely different overall. But when we're looking at the amount of compression and about that tension, that's what we're thinking about. So again, gets really overwhelming. Look at getting some help with that. But standard's going to be more of a class 1 and building up from there depending on what someone needs. This isn't always the first one that someone goes to try, which we'll get to in a second which ones that are, but this is something that a lot of people will fall back to because the other ones are too harsh, too thick, skin irritation, whatnot. The Medi 550 is a nice softer option that's still a good flat knit option. The next garment we're going to talk about is a flat knit garment, but it's the only one that is an off the shelf. So this is a Exo Strong, so an LNR Solaris Exo Strong. I don't have the leg piece right now, but I do have the arm one with me, and it's the exact same type of fabric. So it is still a flat knit garment that has, you can see the seam down the back, that's how flat knit are. This is not customized, which I think you can get it customized, but these are off the shelf. So most flat knit custom garments are extremely expensive. They can be hundreds, if not unfortunately thousands of dollars, and insurance doesn't always cover them. So for those who are in a financial situation, the Exo Strong is an option because it's going to be a lot cheaper. And again, I'll put a link down below so you can check that out. It is going to be a flat knit garment that gives good high containment pressure. It's not always perfect because you have to be able to fit the silhouette well in order for it to work, which doesn't happen very often. Because they are off the shelf, they come in sizes small, medium, large, I'll think all the way to extra large. They have a few different lengths in size 2, but they aren't going to fit everyone's shape perfectly. The flat knit garment's going to still be really durable. It's still a really good product overall. It will have that silicone band at the top with the knee-high option, as well as these usually have really good foot coverage, and it has a longer foot. So if someone has a shorter foot, you may want to look at that and make sure it's not a problem for you, because usually on the foot piece, this is a little bit longer. I still really love that LNR made this off-the-shelf flat knit option because it's such a rare thing, but it can really benefit a lot of people due to the cheaper price. The next one I'm going to talk about is the newest garment out there as of now. This is the JOBST Confidence. So the Confidence is still a flat knit garment that is customized, but it is a little bit less intensive than the next one I'm going to talk about, which is the JOBST Elvarex. The JOBST Confidence does also have an option to get a knee relief area, which means that there is less tension there for any tourniqueting and has more flexibility without the irritation behind the knee. But the Confidence is still going to be a nice, good quality product that is, again, you're going to get the seam down the back. It is customized for someone, so it will fit well for someone, but it's not as much containment as this last one we're going to talk about next. It will have that silicone beading at the top if you choose to. This is that woven in fabric, the woven in silicone, and this one you can't really see it, but it's going to give that grip up top as well. This is the below the knee. It does also have above the knee, or excuse me, thigh high garment as well as a range of, I think, about 5 or 6 different colors. I would say compared to the others, this is another softer flat knit option. It's going to be a little less harsh with the fabric on the skin. So the last garment is more of that we call gold standard garment for someone who has moderate to significant lymphedema. It is going to be the JOBST Elvarex garment. So most people know this because it's a widely used garment. It is a customized garment, okay? It will be shaped for you. This is a thigh piece. It does have really good containment. You can get it in class 1, class 2, class 3, class 4, and up. It will give you the best containment overall of all of the garments. The downside of the Elvarex is that it does contain some latex. So those who have any allergies or any skin issues, sometimes this one is not going to work, where they need to look back at the Confidence or the Medi 550 or something else like that. When someone has a lot of swelling, they'll even double layer these. They'll have a thigh high garment and maybe a knee high garment on top of that. And whatever someone needs, their therapist will work with them. You can, I didn't talk about on the other ones, but you will also get a toe cap. So it's like a small glove on the toes that you can wear because these are going to remain open-toed. They'll have a really nice thick band at the top for either the knee high or the thigh high, and they do come in a full pant. You can get them in capri style, so up to the waist, but only to knee high. And then you can get a lower leg piece from there. You can get, full leg on one with the pant and maybe just a biker short on the other. The JOBST Elvarex is really going to give you opportunity to shape and make what kind of garments you want. So whatever type of swelling or lymphedema you have, you can really alter this or your garments to fit what your needs are. So those are the main compression stockings and garments out there that are more of that medical level compression. There are hundreds of more compression stockings out on the market right now, but I just wanted to focus on the ones that I see the most and that are most popular. If a compression garment or stocking does not work for someone or does not work for you, there are options such as a Velcro wrap. Because there are a lot of Velcro wraps out there, I'm going to create a completely different video on Velcro wraps, as well as another video for nighttime garments. If those are something that you're interested in, be sure to subscribe down below so you can see when those come out. I hope that helps break down these brands and these names that you may have heard of before when you're looking at garments, to give you an idea of where they may fall into on the level of containment and what type and amount of swelling that they're used for. For more videos on lymphedema treatment, management, and product reviews, be sure to subscribe down below and press the like button if you found this video helpful. We'll see you all next week for another video. Thanks everyone.